Hi, my name is Karen.
Hi, my name is Claire. We are nurses here to teach you how to give yourself insulin at home and answer any questions that you have about diabetes. Is now a good time to talk?
Yes, I'm ready to learn how to do this so I can get out of here.
Perfect. I love the enthusiasm. Who do you have here with you today?
This is my mom.
Hi, it's nice to meet you both. Now, is English your preferred language to learn with?
Yes.
Okay, first we're going to talk about diabetes. What is your understanding of diabetes type 1?
I'm not really sure. All I know is there's something wrong with my sugar and it makes me feel sick.
You're on the right track. Diabetes causes high blood sugar because your body does not produce insulin. Think of insulin like a key that unlocks the door to your cells so that sugar can go inside. Without this key, your body cells cannot use sugar to give you energy to do things like walk or study. Does that make sense to you? Since your body does not make insulin, you'll have to inject insulin into your body when your blood sugar gets high, like after you eat a meal. Have you checked your own blood sugar before?
Yes.
That's great. It is extremely important that you keep your blood sugar within the range of 70 to 110. If your sugar is above 110, you may feel tired, hungry, thirsty, and you may also feel like you have to pee more than usual. If your sugar stays high for months to years, you may develop things like kidney damage, slow wound healing that may result in amputation, and nerve damage that can lead to blindness. Sugar is very damaging to the blood vessels as well. So these complications and everything we talk about today is in this handout. I shared a lot of information with you, and I feel that it may be overwhelming. So do you have any questions so far?
Not right now.
Now, in your own words, can you tell me what type 1 diabetes is about?
So my body doesn't make enough insulin, so that's why my blood sugar gets high. Without the insulin, my body can't use the sugar to get energy.
That's great. Now tell me how that you would manage your diabetes at home, and why is it important to do so?
So after I check my blood sugar, I will give myself an insulin injection to make sure my blood sugar is less than 110. I have to do this because high blood sugar can lead to blindness and amputation, like you said, but there's other things that it could also lead to.
Very good. We'll start talking about insulin injections. There's a diagram on the handout that I have gave to you. It's right here. It's the places that you can inject your cells. So some of the places that you can inject your cells are the lower abdomen right here, or your outer thigh. Another person can even inject it into the back of your arm, like right in this area. You don't have to inject yourself today in the clinic, but could you also point to the areas on yourself where you would do it?
So outer thighs and stomach.
All right, that's correct. And now Claire is going to demonstrate how to use your insulin pen.
Alright, so this is an insulin pen and you have to prime it every time you use it to make sure it's actually working. So first you're going to take off the cap and then you will put this needle cap on. So you will carefully twist this on to make sure that that's screwed. And then you're going to take that part off. Like that. Then you're going to prime the pin to the number 2. And you are going to hold it over the trash can and press the pin. So if you see insulin come out of the needle, then you know that your pin is ready to go. If not, you're going to try again and put a new needle cap on. So I'm going to put this back on just to be safe. And then next, determine how much insulin you're going to need. You give yourself based on your blood sugar reading. So the scale will be given to you by your doctor normally. You're going to turn the dial to the right number. So let's say in this case that your insulin, or that you need 3 units of insulin. So you will turn it to number 3. Then you will take your alcohol swab and wipe your lower abdomen or wherever you want to inject yourself for 15 seconds. Then you will let this air dry after you wipe for 15 seconds. You will then take the cap off just like that. And you're going to hold it with your thumb on the pins that you're ready to inject it when you need to. You're going to pinch your skin where you want, and then doing this separates the fat cells from the muscle cells, so insulin works best if you're injecting it into your fat cells. While squeezing the abdomen like this, you're going to press the pin into your skin until you hear a click. So there's the click. Press the top button like this and hold for 10 seconds to make sure you get all the insulin in there. 3, 4, 5, 6, 7, 8, 9, 10. Then you're going to pull straight up. After, take the needle cap off and put it in your sharp spin. Do you have any questions before you try it on your own?
How long will she need to take insulin shots for?
She will have type 1 diabetes for the rest of her life, so she will need to take insulin shots and check her sugar every day, as there is no cure at this time. This condition is manageable, and she can live a high-quality life if her blood sugar remains within the normal range. Corinna, how do you feel about injecting yourself?
I'm very nervous. I'm afraid it's gonna hurt, and I'm not sure if I'm gonna do it right. But I'm excited to get out of here, and I want to learn so I don't get sick again.
Being nervous about insulin injections is common in people with diabetes. With practice, you'll get the hang of it and feel more comfortable.
10 seconds. And hit the click. 10 seconds. And then
In the sharps container.
All right, it seems like you've understood this skill very well. Is there anything that we can do for you before we leave? Do you have any questions?
Not right now. Thank you.
In this teaching video, we ensured the health literacy factors of our patient population. We ensured that the patient's preferred language was used when presenting the education information. We made sure that the patient's environment felt comfortable. We also made sure that the patient felt confident about sticking themselves with the insulin pen and fully understood all of the needed information to successfully perform the skill on their own. Overall, we ensured patient readiness and adequate health literacy by addressing personal, sociocultural, and situational factors in the questions we asked the patient. If we had a patient of a different culture, we would ensure that the patient's primary language was used through a translator and modification of the education handout to their primary language. If we had a patient of a different age, we would ensure patient reading levels before giving them the education handout. Teaching would be modified to a lower reading level if necessary. If patient age was increased, we would be sure to talk slower when teaching to ensure full understanding of the information given. Words might also be increased in size on the teaching handout if patient has a visual deficit. Learning how to manage diabetes is essential to living a high-quality life and increasing your overall health. We feel it is very important to take into consideration all possible health literacy, patient readiness, and patient population factors when teaching patients about managing their diabetes. Diabetes can be an overwhelming diagnosis, but with adequate teaching, it can be successfully managed.